Hello, everybody. Welcome to the UEA Nursing Podcast. My name is Joe Ellis-Gage, and I'm one of the lecturers on the Children and Young People's Nursing course. And today I'm joined by Imogen, who's come in to talk about her first year as a qualified nurse. So welcome, Imogen.
Thank you.
Do you want to start just by telling us who you are and what course you did and where you are now?
Yeah, so I'm Imogen. I was in September 2019 cohort, so I qualified this summer of 2022. I done the children's nursing degree, and I'm currently working at a local hospital on the children's ward.
Okay.
So we kind of see a bit of medical, a bit of surgical, and I've got a rotation down to A&E, but I haven't done that yet.
Oh, okay, brilliant. So you're in a post that's going to move you around a bit for...
Yeah.
When do you move on to the A&E part?
I think maybe in the new year. I done one shift down there, but that was kind of like an odd shift, and I've not been back because the rotation hasn't started yet. But
okay,
yeah.
Cool.
Yeah.
Very good. So we've asked you to come in because one of the things that a lot of students start to get nervous about in their final year, once they get through to that third year, is that realisation that they're suddenly going to be registered nurses. And although that's very exciting, it also can be quite worrying. So what we wanted to do was come and ask you about your experience of the last year, telling us what's gone well, what's not gone so well, how much you've enjoyed it, the support you've got, all that kind of stuff. So I wonder if you could start by telling me, thinking back to just over a year ago, and you'd been offered your job, you were just finishing, you knew you'd finished your course. What were you worried about when you were thinking about starting a new job? And also, what were you excited about? What were you looking forward to?
I was excited to just get into the job and get going, because I feel like when you're on your last placement in third year, you don't want to be supervised by your supervisor or your assessor. You just want to get out there and have your own patients and do your own meds and just kind of have that autonomy. But then I was a bit nervous about fitting into the team, just like normal going to a new job situation. I'm kind of worried about managing my time, because I like things to be done at a set time, but I know with the ward pressures, it's never going to happen. And I think that's probably the one thing that I struggled with the most when I first started. I'd get my patients, I'd get my workload, and I'd know, right, my obs are due this time, my meds are due this time. But if you get an admission, your obs might be 10 minutes late. And then I really struggled with that, because I knew my obs were due at that time. So I was like running around trying to get everything done when actually 10 minutes is all right. Like,
yeah. So and as yourself is someone who likes to get things done just so, keeping things on time, doing it, which probably as a student nurse is a bit easier, because you've only got your patients to worry about, a smaller group. Someone else can cover you if you're doing other stuff, and then suddenly it's all on your head. Yeah,
literally. And I feel at the start as well, now I feel I can ask other people to help me, and I feel confident to do that. But when I first started, I felt like these are my patients. I couldn't ask anyone else to do anything, because I felt like everyone had their own patients. But actually, you're all a team, and everyone is happy to help. So if you've got some meds due and you're busy doing something else, someone else will do your meds. But to start with, I was very much like, no, they're my meds, they're my obs, I can do it, and you can't.
Yeah, and that's so those first roles, sort of first post, students often, or registered nurses, when they stop being students, have that feeling of, now I'm registered, I need to be able to do everything myself.
Yep.
Keep everything up to date. That's the whole point of me having this role now. But at the same time, if you're asked to do something by a colleague, you'll happily go and help them.
Yeah.
So why wouldn't they come and help you if you ask the same thing?
Literally.
Yeah.
I just feel like I don't know, I feel like you kind of want to prove yourself, especially as the place that I work, bar one or two placements, I'd done all of my placements there. So they'd send me from my first year all the way up until newly qualified. And I always had good feedback from being a student. And I felt like I just wanted to keep that going. But when you're newly qualified, although you do know things, you feel like you don't know anything. And I just wanted to kind of prove that I was who they thought I was. And it's a lot harder to keep up than you think.
Yeah, that's interesting, going back to a place, because some people will go and get a job somewhere they've never worked before, they've got no experience in that area, which might be quite intimidating, but it's equally intimidating going somewhere that they already know you.
Yeah.
And you've got probably two things to think about. You've got, I hope they don't keep treating me as a student nurse and having that step into being a registered nurse. And then once you do that, the whole kind of, I'm going to prove myself. I've got to find my own feet and do my own thing. Going back to the things that you were kind of excited for, you felt you got to that point in that final placement of your final year of being a student nurse, and clearly you felt ready to finish.
Yeah, I definitely did. I think it got to like the last maybe 6 weeks, and I was counting down each shift. I was like, oh, nearly there, the last little bit, nearly there now, only so many hours to go. And I think because I had finished all the assignments, I knew I'd passed them, it was literally just signing off them hours. I'd done all of my competencies, so it literally, I was there for the hours, but I felt like I'd done like one management day because I'd done it in A&E, so at the same hospital I'm at now. And I felt when I done my management day there, I don't know, I was kind of running the department, obviously supervised, and I felt confident to do that. And everyone was like, oh, wow, you're doing really well. And I feel at that point, I was very much like, I just want to qualify now. I just want to be able to go off and do my own thing with my patients rather than being like, oh, is it all right if I can see this patient? Is it right if I, whereas now they give you your handover and they say, who do you want? So I can say, oh, can I have this person? And I feel as a student, you kind of have the patients who your supervisor or assessor has.
Yeah, yeah. And did you feel at the start of your third year, did you feel ready then?
No.
Because that's another thing people often say. They start the third year. When you go out on you go out on a placement in the third year really early on the PDP placement that we have. People go, I'm a third year now and they expect loads from me. And I go, it's all right. By the end of your year, you'll all be confident. And generally, I think people get there.
Yeah.
But it's nice and reassuring probably for people to hear that you didn't feel ready at the start of the final year, but you did by the time you finished.
Yeah, definitely. When I first went into third year, I think the change between first and second year, it was a big jump academically, but I feel in terms of placement, I don't think it was overly. But I think second to third year, as soon as you go into placement and say, oh yeah, I'm a third year, they're like, wonderful, you're qualifying soon. And then they just expect so much more of you. And I was like, again, I still didn't feel ready to qualify. I feel like I didn't know enough. And I think you always compare yourself to the year before you that have qualified. And I remember looking back at them and I thought, oh my God, I don't know as much as they knew. And then, yeah, by the final placement in the third year, I was like, oh, get me qualified. Can't wait.
That's reassuring. That's the whole point. Like that, we wouldn't have a third year of nursing if you were ready at the start of it. You wouldn't need it. That's the whole. So having that third year is really important. So tell us about what's gone well. So you've been in post a year, roughly.
Yeah.
What's gone well over the last year?
I feel that, to be honest, in terms of my time management, I feel that's got so much better. Like I said, I was very much, this needs to be done at this time, this needs to be done at this time. Over the year, I've kind of realised it's about prioritising your patients. If you get a really poorly one in an admission, your 4-hourly obs can wait the extra 10 minutes, or someone else who's free can do them. You need to focus on your poorly patient in front of you. And sometimes ward demands as well. You could be really short-staffed and be on a full ward, and actually you could have 5-6 patients and you're running around trying to organise everything, but you will get to things when you get to things. And as I say, again, it's all about prioritising who needs what when. So I think that's got a lot better. The support I had actually, I'm not speaking for everyone who's newly qualified because I'm not sure, but the support I've had from the place I work is really, really good.
Okay.
I had a lot of support when I was a student there. And again, that's kind of a reason I wanted to apply there. And yeah, the support I've had since newly qualified has been really, really positive. Any problems I've had, everyone's just so approachable, and I literally can speak to any of the senior staff. So yeah, I feel that's quite a good thing. There's not even just one person I can speak to. There's quite a range. And I feel I'm really coming out of my shell and developing who I am as a nurse, really.
Oh, that's good.
Yeah.
So, and your sort of timekeeping and understanding about all that, there's a realization I think that you sometimes get is that you can't be perfect. It's not going to be that everything is done exactly as you want it to be. And that's a really important transition to make, because you can't sustain perfection in a nursing role. You have to just adapt every shift. And
yeah, definitely. I feel when you first start, you think you're going to be this amazing nurse who knows everything, any question that anyone asks, you're going to know the answer to. And you think, yeah, I've got this, I can look after all my patients on my own. But actually the reality is, no, you can't. You always need that support of other people. And at the end of the day, we are human. We're not just like robots who go into work and can do everything on time.
Yeah.
Things are going to be a little bit skewed depending on the ward. So yeah, I think if I'd realised that a bit sooner and been a bit kinder to myself, I maybe would have had a bit more of a settled couple of months when I first started. But I think I was so hard on myself that I needed to be this amazing person that I thought I had to be because I thought that's what they wanted.
Yeah.
But actually they just wanted me. So
yeah, they wanted you for the person you are
Yeah.
and the taking on of that role. And that comment you made a minute ago about you finish and you need to know everything.
Mm-hmm.
So 2 questions for you.
Mm-hmm.
Did you know everything when you finished the training? And do you know everything about nursing now?
no and no.
There you go.
I definitely thought I knew everything when I finished third year. I think you finish third year and you think, yeah, I've done all of these assignments, I've done all of these placements, I'm so clued up, I know exactly what I'm doing. And you get your first patient newly qualified and a parent asks you a question, you think, oh my God, I know nothing. And I just remember standing there thinking, I don't know the answer. But instead of like trying to guess, I was like, I don't know, let me find out. And again, I found that really hard because I thought to myself, but you knew everything. You know, you're qualified, you should know everything. But yeah, I'm very much settled with the fact that I don't know everything, and I'm quite happy with that now.
Yeah, that's really important. And you'll never know everything.
Yeah.
You know, and the problem is with not the problem, the basis of our nursing degree is that we're giving you the core kind of training, but you could qualify and then go and work in a children's ward, in a neonatal ward, in an emergency department, in a community setting. Some people don't even work in clinical settings generally. They work in schools, or there's so many places people go to work that it's impossible. We can't teach everything in those 3 years. And the quicker people realise that, the better, because the pressure people put on themselves to know everything. And as lecturers, we don't know everything. I mean, there's reasons why certain people teach certain sessions because they know more about it.
Yeah.
So yeah, that's a really important thing to kind of get to grips with. Now, you said you were tough on yourself in the first few months. How did that work? What did anything actually go wrong? Was there any justification for being tough on yourself, or?
I don't think so. I think just a bit of that imposter syndrome. Like, I didn't come to uni in the usual way. I hadn't done my A-levels. I wasn't doing anything similar to nursing or anything really before I come to uni. I was doing something very creative. I was doing dance, so completely different. And I hadn't, obviously done my A-levels, so I had to do my access course coming in. And I feel all through uni, I had a bit of imposter syndrome, feeling like I shouldn't be here. I say everyone, not everyone, but I felt like most people had done the A-levels, they knew so much more than me. And even when I qualified, I felt like, oh, you shouldn't be here. It's not, who you kidding kind of thing. So then when I started, again, I still felt like I've literally, done my 3 years. I didn't fail an assignment. I didn't fail a placement. And now I'm here. To me, it just didn't make sense. I don't know. It just wasn't very me. So then I was, trying to, make myself fit into this perfect nurse that I thought I had to be. And I remember my first realization of this was they put me on the surgical end. And so on our ward, we have a medical end and a surgical end, but they are all joined, so you can walk up and down and get help if needed. And I was down in the surgical end on my own as the only trained, and then I had 2 nurses with me, which was fine. But there was some IVs that were due. There was only 2 over the 12-hour shift, but I wasn't IV trained at the time, and I'd only been there about 6 weeks. I literally just sobbed because I was like, oh my God, I can't do my patients' IVs. And they were like, well, someone can come and do them for you. But I think that whole idea of someone having to come and do my work for me, I just really struggled with it. So they swapped me and I was down the medical end. But yeah, I think it was at that time I was like, why are you being hard on yourself? But that was the first time that I literally like burst into tears, like middle of handover. But yeah, I mean, I've obviously had a couple of cries since. But yeah, that was probably the first time that I realised, don't be hard on yourself, because it's not worth it. People are there to support you. And actually, if I'd have said, I'm not happy to go down there on my own, they would have just swapped me without me getting upset about it.
Yeah. And in that situation, the only reason you couldn't do that was because you hadn't been through their process and training anyway.
Yeah.
It wasn't through lack of willing or lack of knowledge or lack of anything, other than the fact you weren't allowed to do it yet. And that is another really important point, is all those people you were working with were once newly qualified nurses. And that's what we say to students sometimes who are worried about placements, is all of your supervisors were once student nurses, all of your colleagues were once newly qualified, and they will remember. Some of them might have to remember further back than others, but they'll remember those things they could or couldn't do. Yeah. And those bad shifts, and actually just being open about it probably helps, and just chatting to them. Yeah, definitely. Like, they all said to me, they're like, oh, you didn't need to get upset. Like, if you would have just said, that you weren't happy to go down there. And I was like, oh, it's not that I wasn't happy. I just felt like I couldn't do what my patients needed. And for me, I really struggled. Like, again, I just wanted to be able to provide my patients with the care that they needed. And for me, I felt like I couldn't do that because I couldn't do their IVs, although other people could. But yeah, for me, I just felt a bit like a failure at the time. But then looking back, I think, why did you get upset about that? Like, it was really nothing to get upset about. Yeah. But yeah, I think it's just one of them things that, you just kind of have to get over, really. And yeah, I did struggle. So I think that must have been like 6 weeks or 2 months in or something. And then obviously you have your really bad shifts, and you sometimes go home and you think, oh my God, why am I doing this? Okay, tell us about a bad shift. Give us an example of what you mean by a bad shift. Like where you're really short-staffed, the ward is full, and again, you've got some, I don't know, for example, like MRIs under sedation, you've got to be EPALS trained. I'm still to this day not EPALS trained, so I can't go down with anybody to escort them. So the nurse in charge normally has to go down, but then that would leave like maybe 3 nurses on the ward, and then a nurse had to go down to A&E for an emergency. So then the most newly qualified for about an hour was me, and I'd been there all of 3 months or 3.5 months. And I just remember standing there thinking, oh, what am I going to do? If anyone needs anything, I can't do anything. I can do a set of obs. I can do some oral meds. I can't do IV still. So yeah, I was like, I went home really stressed with a really bad headache, and I just laid in bed and I thought, why do you do this? Why do you put yourself through it? But yeah, you do it because you love it. And actually, when you do go home and you have the really good days, it kind of outweighs your bad. And you obviously get your middly days, but yeah, you think, why do I do it? But a year later, I know why I do it, so. Yeah, well, you're still there. Exactly. And you're still enjoying most of the shift. Yeah. I think it's important to understand that you're not going to enjoy everything you do. It's an unrealistic expectation. You're setting yourself up to fail if you're imagining every shift to be you kind of wandering through the ward, saving lives and making everyone feel better. And it's not always going to be like that. I think that thing that you just mentioned about saving lives as well is so like important, because again, when I first started, I was like, I'm going to go in every shift and save all these lives. Reality is you don't. Like, a lot of people come in, they're just, acutely unwell. You get them a little bit better and they go home and finish getting better in the community. So like a lot of the time, I think I'm going to do all these miraculous things and cure all these children. And the reality is you don't. And, it's obviously you do save lives, but, it's not as often as you like to think. And not as dramatic as you might think all the time. Yeah. So, yeah, I think for me that was quite an unrealistic expectation when I first went in. But I think what you probably don't always realise is how many lives you may not have saved in a dramatic way, but you may have changed or improved by being there. Yeah. And I think, like we talked about, I couldn't do my IVs, or I was worried about doing this. We get really task focused as nurses about all the jobs that need doing. And realistically, if you're looking after a poorly child, anyone on the unit could do the jobs. The bit the child remembers is the interaction with you and the you making them feel comfortable or explaining something to them, and that's the bit that's actually probably more important. But it's not what we focus on sometimes. We get a bit focused on the exciting stuff or the task stuff.
Yeah, definitely.
And you will have made a huge difference to a number of children over the last year without even realising it. You'll have forgotten even who those children were, and they'll still remember you and their time on the shift when you were there.
Yeah, definitely. I feel as well, like I remember you guys saying when I was here, like I was very focused on OBS and what the pews were telling me when I first qualified and as a third year. And I remember you guys telling me in a lecture, you know, when you walk into a room and you see a patient, you can tell if they're poorly. And I just remember sat there thinking, I'm never going to be able to tell. I just look at the pews, and if they're high, I think, oh, they might be a bit poorly. And if they're low, they probably aren't. And I just remember sitting there thinking, I'm never going to be able to do that. And again, this is only quite a recent realisation in the past couple of months. You just walk into a room, and I now know what you guys mean. You walk into a room, and even if your pews are low, you can just tell if a child is poorly. And you just look at them and think, there's something not right. And then even if the pews are 0, 1, 2, just escalate it, because, yeah, I remember thinking, I'm never going to be able to do that. But now I can.
Yeah, that's interesting, because I remember saying that to your cohort, and I probably say it to them now, is you get that gut instinct. And gut instinct is not some magical thing. It's built on experience and your training and your education, and it all coming together. But there comes a moment when you get it, and you get that confidence to trust it as well.
Yeah.
And we do, the numbers are important, and the obs are important, and all of that sort of stuff. But your eyes and your ears and looking and talking to that child is so important as well. And it's the same with adult patients as well. You get that feeling when you walk in there if something needs to be done now.
Yeah, definitely.
That's interesting. So you talked about kind of some of the challenges that you've had. You talked about some of the things that have kind of gone well. What next for you? So you kind of, I'm saying, we're only a year in, so we don't need you to list your full career plans. But what are your thoughts on where your kind of career is going to go and what you're going to be doing next?
So obviously I'm on the ward at the moment, and they're planning the rotation to A&E. I think my not lifelong plan, but my plan in the next few years, I would like to go to community. I'm just not good with shifts. It's just not for me. And, I know it can be for a lot of people, but for me, I think, it's night shifts, and it's just not good for me. Yeah. I'm just such a tired person. And so I think the community would just offer me that good work-life balance that I think I could need. Not saying that on the ward it isn't, because I only do 3 shifts a week, so I definitely get my 4 days off. But I just think it'd be, being that autonomous practitioner out in the community, I just think I'd really enjoy it. Again, I'll probably be absolutely petrified when I start, because I'd probably feel like I'm on my own, but there is a team, again, with the community that you can always go back to.
Yeah, well, that's interesting. We'll have to come and ask you in a few years to come back, and we'll find out where you are and what you're doing at that point.
Yeah.
So there's just 2 more things I wanted to ask you about. We talked about the support that you've had, and you said you've had really good support.
Yeah.
Just wanted to touch on the preceptorship kind of process and going through that, because that feels like an unknown to people when they start it. Yeah. Give us an overview of how that worked for you.
So on my first week that I went in, I wasn't on the ward straight away. I done 1 week where I was in like the education and training building, and then they gave me multiple booklets and said, over your year you need to complete these. And I remember looking at them and thinking, oh my god, it's never going to happen. And there's skills, you've got 5 reflections to do, meetings every 3 months, and then there was a new starter pack where you had a meeting a month for the first 6 months. Just like different things like your IV training, pills, blood transfusion, like loads of different trainings that you have to get done. And I remember looking and thinking, oh, this is never going to happen. But it just kind of happens naturally without you even knowing. Like within maybe a month or two, I'd signed off a lot of the skills without even realising it.
Yeah.
And it was I found the preceptorship quite good. The only thing I would say is you get given your preceptor, you don't really see your preceptor too much. They say you get your supernumerary period. I don't think I maybe got 3 shifts, and I think I was told 6 weeks. And then I was kind of left to my own devices. They basically said, if you need any help, give us a shout, but kind of just left me to it.
Okay.
In a way, I think that helped me a lot because I'm the sort of person I would always want to hide. So to be kind of just chucked in the deep end, I think did help me. So yeah, in terms of that, I think that could have probably been a bit improved, but that's just my trust. I'm not sure about others.
Yeah.
But the actual preceptorship itself, I thought was really good. The training they offered was really good. It was really in depth and helped a lot. And actually going through the skills and realising actually what is expected of you, I think is really good. And on the 8th of August this year, so 2023, that was my 1 year anniversary from start, because I started 8th of August 2022, and I done my 12-month review on the 9th of August this year, so literally 1 day late. And bar one skill, I've got everything else signed off.
Brilliant.
Done all my reflections. So yeah, looking back, I shouldn't have been so scared
it was achievable.
of all of them. Yeah, it's definitely achievable. Yeah, definitely.
Which I guess leads me to my other question, which is something I try and reassure students of, but you can tell me if I'm wrong. Is it easier being a registered nurse than being a student nurse in terms of your workload and what you're thinking about all the time and all of that kind of stuff?
Yes and no. I'd say to start with, I definitely found being a student easier, because if I struggled with something, I knew that my supervisor or assessor would have it anyway.
Yeah.
And I think...
So that accountability to you is the hard bit. Yeah.
Yeah, definitely. And I feel even doing a set of obs as a student, I knew my assessor and supervisor would be on top of it. So someone would say something to me and I didn't realise it'd go in one ear and out the other. As a student, I didn't realise that was happening until I then started as a nurse, and then someone said the exact same thing to me. I thought, I'm sure that rings a bell. And then I thought, oh, someone probably told me that when I was a student. But because my supervisor assessor was there...
You didn't need to think about it.
No. So to start with, I was getting constant headaches because I was like, oh my God, all this new information. But yeah, now I find it a lot easier than being a student, because obviously you got all your student paperwork to worry about every shift. And I feel as a student, it's always about making a good first impression every single shift.
Yeah.
And I feel I don't know, as a student, again, I put a lot of pressure on myself. I don't know about other students, about you can't have an off day as a student because you're continuously being assessed.
Yeah.
Whereas as a registered nurse,
it's a bit more realistic. You can have a down day, you can forget something and it's not going to be marked off in a booklet or whatever.
Yeah, definitely. So yeah, I do feel, I don't know, it's a bit yes and no. To start with, maybe it's a bit harder, but the longer you're there, the easier it gets.
And you haven't had to write too many essays or anything in the last year.
No,
so
I've not written a single one.
There you go. And
That's
you've been
quite
paid.
Nice. And I've been paid. Yeah, that's always nice as well. Yeah.
Brilliant. Well, I think we've kind of covered a lot over the sort of your first year, what you're worried about, what's gone well, preceptorship. So I think that's been really helpful, and hopefully it's been useful for students who want to watch this in their final year as they're getting ready to apply for jobs, or whether they've got a job offer and they haven't quite started yet. So thank you for coming in.
That's all right. Thank you for having me.
And I'm pleased that you came in, and I'm pleased that your role is going so well.
Thank you.
So hopefully you've found this video useful. If you have, please make sure that you share it with others. You can add comments on if you've got particular questions, and we can come back to you and answer as well. And please look out for the other videos on the channel. Thank you very much.